it goes on, it's on both sides of the spectrum.
Yeah.
So I thought it was always someone who lacked empathy, but it's
That's
both.
narcissism. That's narcissism.
Okay.
Narcissism, the empathy skills, they're so self-absorbed and it's so much of grandiosity. They're wearing a mask that there's no empathy for the other person. Whether it's getting married, whether it's getting divorced, or changing your job, we should never take that decision when the emotions are at height. There's one common factor with a patient with borderline personality disorder, narcissism, and bipolar disorder, which is emotions, emotional dysregulation. So emotional intelligence is what? Emotional intelligence is when you're aware of your own emotions and you are aware of the other person's emotions too. So empathy also comes with that, self-awareness of the emotions come with it, and also along with that, how to maneuver or how to manage your emotions also come with it. Denial, it's shutdown comes later, denial, challenge, because what is narcissism? Narcissism is you're putting yourself on a high pedestal that you are special, you are the best, and then you're having that mask of grandiosity, and you're not going to drop that mask even in front of the therapist.
It is my pleasure to introduce to you Dr. Grover, who is a psychologist, speaker, and life coach. And today we're going to focus on some very interesting things. We're going to be talking about emotional intelligence, emotional maturity, and their connections to, doctor, your specialties in borderline personality disorder, narcissism, and bipolar disorder. My goodness, that's a mouthful, doctor.
Thank you for that, Kim. Thank you for introducing me, and thank you and welcome
Thank you.
On my channel. Yes, it is mouthful. It's a topic which revolves around emotions, emotional intelligence, maturity, very two important factors which are ruling over a narcissistic personality disorders, mind, borderline personality, and a bipolar patient.
And then is that where we begin this discussion, where we find those lines and those connections between what you call someone who is emotionally paralytic?
Yeah, I call it emotionally paralytic. This is my invention when I say it's paralytic, because they're so foggy in a cognitive way that for them, understanding the emotions and having that emotional intelligence and emotional maturity when becomes paralytic, I say they are sometimes emotionally paralytic and we need therapy or treatment for them to get them back to track.
So in layman's terms, for the non-doctor who's out there watching, for myself, you're saying that they become foggy, their brain becomes foggy. So there's no clarity?
Yeah, lack of clarity of mind.
And that lack of clarity is somehow connected to emotions.
Yes, because you see, emotions, it's one brain, one small brain, right? The emotions go at height, the cognitive skills and clarity comes down. So that's why we say, calm down. You are not thinking right at present. Calm down.
I see.
Then you'll be able to think right. So that's the way it works.
And so it must be, though, that it is it's quite the mountain for someone who is dealing with this lack of emotional intelligence, because I know when I get upset, when you get upset, anyone gets upset, right? That heightened feeling of stress and the level of clarity.
Yeah. It is. I saw one very interesting Bollywood movie in that the father takes a decision for a daughter, and she comes to know, and she comes in the house, and he's on the treadmill running on the gym, and she says, "Dad, how dare you take this decision with me? You didn't even discuss this with me. I'm not going to accept that," and stuff. And he says, "At present, you're not thinking right. Calm down. We will meet at dinner and we will talk about it, and I will consider what I have taken a decision for you again." Right? So that's what it is. That when you are angry and upset, you cannot think right. That is why we say any important decision of life, whether it's buying a real estate, whether it's getting married, whether it's getting divorced or changing your job, we should never take that decision when the emotions are at height, right? We need to lower our emotions so that our cognitive skills can work and we can take the right decision.
So the cognitive skill versus the emotional intelligence, those are things that I think many times as people we pull them together.
Yeah.
And as a doctor, you're encouraging, teaching, and telling individuals that those are two separate things and we can function more successfully. Very interesting. I don't know that people realize that, though, that emotional connection can, if it's affecting your IQ test, I would go out, maybe go out on a limb, not a doctor, and say that my emotional state is probably highly connected to being successful, period.
Yeah.
Successful in my life. Successful with my family, in my relationships.
Moods impact everything. Moods impact your intelligence, moods impact your relationship, moods impact your work performance, moods impact everything.
So you talk about emotional intelligence and emotional maturity. How does an individual, how does a person become emotionally intelligent? How is this a skill? Is this something we learn? Is this something we're born with? I mean, just the avenues to go down, doctor, with understanding emotional intelligence, and then what we all hope we have, emotional maturity. It's kind of overwhelming.
Very interesting question. The thing is that the person is born with a brain, part of the brain known as limbic system, which controls and manages the emotions and thinking emotions of the person. Now, when we say that are you born with it, yes, emotional development is a very important part of development of a child or of a person born, and then it goes on to the various phases of life as we grow in age. So yes, we are born with limbic system which manages emotions, but emotional development goes through various other factors around the person or around the child.
So we're born with this lymphatic system. It's our structure, it's our brain, and our emotional intelligence is tied into that. And we then know there's parallels, right, between that emotional intelligence lymphatic system.
Limbic system.
Limbic system.
Limbic.
What she said. It's a good thing you're the doctor. And narcissism and personality disorder. And it seems like this is so woven together but still so complex. So help me understand now how we're bridging that emotional intelligence and how that affects a personality disorder and narcissism, and my goodness, it's so much.
Yeah, because there's one common factor with a patient with borderline personality disorder, narcissism, and bipolar disorder, which is emotions, emotional dysregulation. Right? So emotional intelligence is what? Emotional intelligence is when you are aware of your own emotions and you are aware of the other person's emotions too. So empathy also comes with that, self-awareness of the emotions come with it, and also along with that, how to maneuver or how to manage your emotions also come with it. So now the patient with borderline personality disorder, for them the emotional intelligence, the way it works is that for them they do have emotional intelligence, but the empathy, it's right, sometimes very oversensitive, very empathetic, and the other time too much self-engrossed and don't have much of empathy for the other person.
Okay, so borderline personality disorder, it's on both sides of the spectrum.
Yeah.
So I thought it was always someone who lacked empathy, but
No,
it's
that's
both.
narcissism. That's narcissism.
Okay.
Narcissism, the empathy skills, they're so self-absorbed and it's so much of grandiosity. They're wearing a mask that there's no empathy for the other person.
So borderline personality disorder. They have the feelings, but they can't regulate the feelings.
Yes, sometimes when they can't regulate. But when in a bipolar disorder patient, they have emotional dysregulation issue. But when they are stable with the moods, when they are not going through any depression, or that they are not going through
a narcissist
no,
specific,
a bipolar
person. Okay.
When they are not going through any episode of depression or of manic, then they are stable. They do have good empathy. They can have good empathy. With borderline, it's on the spectrum. Sometimes overtly sensitive, too much empathy, and sometimes they have no empathy. It's because when the emotions are not under control, or they're not regulated in the right way.
So we actually have 3 different paths here, right? So we have borderline personality disorder. You mentioned bipolar, and that is also a personality disorder?
No, bipolar disorder is not a personality.
Not a personality disorder. Narcissism, is that a personality disorder?
Yes.
Okay. And these are 3 very separate labels, diagnoses?
We don't like using the word labels. It's a diagnosis.
A diagnosis.
It's a mental health issue.
Now, earlier we were discussing, when we were talking about emotional intelligence and when we were talking about emotional maturity, I had asked you about the actual physical makeup, you know, when we're born, and you were discussing the brain. Do we, medically, are we in a place, have we found, are there any connections between these disorders and the actual structure of a person's brain?
Yes, it has been found out. That is why they do sometimes the MRIs of the brain and the CT scans, and specifically if there are other medical reasons, right? Like, for example, if you have some brain injury, or you were born with certain brain deformity or disorder or neurology issue, then of course it is going to impact the limbic system, and these personality disorders can, to begin with, can be because of the medical reason of the brain damage which has happened.
So physically, there can be a setting that creates, I suppose, an open door to these disorders. So then you kind of get to that place where you look at nature versus nurture.
Yes, but being a psychologist, I am more into not medically a brain disorder, personality disorder which is coming because of the brain disorder, but I am more into being a psychologist, into personality developments. Like for borderline personality, most of the time the cases are, they start at the age of 16, 15, 16, but still we cannot diagnose them till they're 18 because it's disorder which can only be diagnosed when the patient is age 18 or above. But I usually see that according to my research, it starts at 16 and that it carries on, and if left untreated, it can go on for many years of life. But if treatment starts, most of the time the transition starts at the age of 26, and by the time the patient is 32, they bid goodbye to borderline personality disorder. But I cannot promise anything as far as age or things are concerned as far as narcissistic personality disorder is concerned.
So everything's out the window when it's
narcissism. Because we need to understand that for them, what is the main aim? How are we going to start therapy? We are going to start therapy when the patient is going to come to you, knock at your door and say, hey, I have some issues with my emotions. I'm not feeling right, right? Okay. And then we dig in deeper, and then we come to know, okay, you are having some symptoms or traits of borderline, or you're having some symptoms of narcissism or narcissistic. As far as borderline personality disorder is concerned, the moment I say this being a therapist, it is acceptable to quite many patients, and they'll say, okay, I want to be treated, and they'll be committed to treatment and therapy. The moment I blurt out the word narcissism or narcissistic, no, what do you mean? No, no. out of the window.
Complete shutdown.
Denial, complete denial. It's shutdown comes later. Denial, challenge, because what is narcissism? Narcissism is you're putting yourself on a high pedestal that you are special, you are the best, and then you're having that mask of grandiosity, and you're not going to drop that mask even in front of the therapist. So it's very hard to treat a person with narcissistic personality disorder, but with borderline, yes. When we come into emotional intelligence and emotional maturity is one step further. Emotional maturity is when you are composed, you are grounded, even in a stressful or even in a situation which is demanding your overreaction. But you are not reacting, but you know how to respond. It's a very important word which we call resilience, right? So when the person has gone through it and comes back, it's like a spring, right? You've gone through that stressful situation, but with the spring back, you do come back. You do know how to cope with it. That's emotional maturity. Emotional maturity is something which you have knowledge to choose your battles. That's what emotional maturity. That's maturity is.
It's recognizing.
It's one step further to recognizing. It's more involving recognizing and whether I should react. Do I need to react, or should I just sit back and respond when I have clarity of mind?
Dr. Grover, with emotions, with people, in life, with these disorders, things are objective, things are subjective. I expect emotions are objective and subjective. And how does that play into narcissism and borderline personality disorder?
Very interesting question. I like this question because I have done quite a lot of research also with my patients over this. The conclusion which I have come to, that the patient with narcissism or narcissistic personality disorder, for them, the way they show or express their emotions are in a very objective way. For example, they will be angry that, okay, I am angry because you left 3 dishes in the sink. Okay, and even when they have to show love, they will give you things. Okay, I love you, so I bought a phone for you. Okay, I love you, we love you, so we're going to pay the phone bill for you. This is all objective, right? It's never that I am upset because you don't love me. I am upset because you didn't give me a hug or a kiss. I am upset because I'm feeling you're out of it. It's never subjective. For borderline personality disorder, it's always subjective. It's always subjective. I am going to harm myself because you don't love me anymore.
So when you're defining objective versus subjective, are we defining that as something within ourselves versus something outside of ourselves?
Yes, you can see the emotion of anger. You are angry and upset because there are 3 dishes in the sink. It's objective.
It's this thing
objective
that made me angry.
Objective.
Versus I'm not getting the feeling from you
of being loved. That's with borderline personality, right? I am angry and I'm sad and upset because you don't love me anymore. I am sad and upset because nobody loves me. So it's so subjective, right? It's never objective. They will never say that I am upset because you left 3 dishes in the sink, or I am upset you didn't give me a good birthday present. They never react emotionally like that.
For a personality disorder.
Borderline personality disorder.
Where the narcissist is almost grounded in the things.
The outward, right? Because you see, their whole profile is outward. Because that's what I say, with the patient with narcissistic personality disorder, they are socially intelligent, but they're not emotionally intelligent, right? Because it's all about public, it's all about outside, it's all about outward world. It's nothing about what's inside. There's no empathy, right? You are not trying even yourself to put yourself in other person's shoes. And with borderline, overtly empathetic,
I see.
all about love, all about romance, all about feeling. Because in my previous videos, I have explained in borderline personality disorder diagnosis and treatment, which I did 11 months back, 10 months back, I think, that they fall on a triangle. Insecurity, leading to fear of rejection and fear of abandonment. Most of the cases of borderline personality disorder, especially female cases, women, I have found out the main reason for them to have those personality symptoms is because they had been abandoned or neglected by their mother.
Whoa.
When in childhood.
That's like, we need to take a second and sit with that.
Okay, okay.
So, Dr. Grover, you have found in your practice and in your time with your patients, specifically for female patients, that maternal rejection is so much at the root of borderline personality disorder. You just what you just told us, that's huge. That this borderline personality disorder in your female patients is so deeply connected to rejection or perceived rejection from one's mother. That's like
rejection, abandonment.
That's
yeah. Because you see, and not only this, because motherhood, parenthood, very important factors in development, in personality development. So when the motherhood is missing, and or in case of if a mother is narcissistic and she is throwing objects over the kid to show that, oh, that's the way I love you, okay, throwing objects, not giving time, neglecting, want perfection, and throwing objects, oh, this is a new toy for you because I love you. The development of that child is going to be in such a way that their compassion circuit is going to be either overtly shut down, or their compassion circuit is going to be eitherly very sensitive. So what are they doing? The borderline personality patient, they're always seeking love outside they crawl wherever they see some feelings of love. Anybody shows them love and care, they will crawl there.
wow.
Because they have been neglected and abandoned by the mother when they needed that love and that attention at a certain age. So that's the underlying root cause, reasons of patients with borderline personality disorder.
And that points back to what we were discussing really at the very beginning of the program when we were talking about emotional intelligence, emotional regulation, emotional maturity.
Yeah.
So you have borderline personality disorder because of emotional deregulation.
Deregulation, and they really have to work hard to learn about emotional maturity.
Wow.
They are emotionally intelligent, but then they lose it because of their oversensitive sensitivity towards various scenarios, and then the dysregulation comes. In the morning, it is to the point, then I am happy, I am good, I love you, and in the evening, oh my God, horrible day. I don't know what I ate in the morning. It spoiled it all. So that's borderline.
So
but bipolar is something which is depression and sadness for 7 days or more than 7 days, right? So out here, that's the difference between, but the dysregulation is a lot. Right?
For bipolar.
Bipolar.
So you have, I mean, it's so interesting, doctor. So with the maturing of your emotions and perhaps working with the doctor, if you are someone with personality disorder, you can find your way out of that.
Yeah, personality disorder, once you're aware of it, so many patients, they come to me and they say, and now these days, thank you to Google and internet and YouTube channels and videos. So now when they come to, they say, you know what, I went through certain websites and certain things, and I think I do have symptoms of borderline personality disorder. I want to be treated. Not only this, they are in a good relationship, and then they want to remain in that relationship. They really love the person and the other person loves them too. It's very hard to maintain and sustain the relationship. So they come to our clinic that I really want to remain in this relationship, so I need help.
Yeah.
So that's the beginning point. They are coming to me to maintain and sustain the relationship with their boyfriend or with their partner, but then I land up doing tests over them, personality, and then we detect, oh, you have borderline personality disorder. So that's what we start with awareness. Awareness is the key point of any treatment of borderline personality disorder or any treatment of any mental health issue. And then we start treatment. And with treatment, they learn how to be emotionally mature, because once again I will say emotional maturity is being in a stressful situation and learning how to come out of it, fight out of it, or not reacting to certain situations but responding to them later on.
It sounds a lot like you're learning to take the emotion and the logic and separate them. Right? So that the logic and the cognitive side of your brain and of your personality can see the emotion and still then choose to make good decisions for you as a whole person, right? Instead of emotionally following your heart.
Yeah,
to follow your heart.
But that's what the patient with borderline personality do. They first follow their heart. They don't think, but when they are finding hard to maintain and sustain a relationship, they are left with no option. They have to learn how to follow their mind too.
So it sounds like someone, the type of patient we've been discussing here with the borderline personality disorder, there's tremendous hope for a positive outcome. There's a tremendous hope for a future that's happy and healthy once it's recognized, right? And once the desire to be healthy, that's attainable. With narcissism, though,
that is a hard one.
I don't know that, you know, some poor child whose mother's a narcissist, or some spouse or partner who's found themselves tied to or married to a narcissist. How do they identify that? And if they have identified that, what do they do? Is there hope for that?
The patient with narcissistic personality disorder hardly recognizes that they are going through this. It is the person who is dealing with them. They come to our clinic, or maybe even they are bought by the narcissistic mother, that hey, she is depressed or she is having panic attacks and she is anxious, if you can support her. Okay, we will start with the clinical interview. All right, depression, anxiety, and then when we go more into it therapeutically, then we come to know that it's more than that. It's she or he is coping with the narcissism or narcissistic personality disorder of the parent or of the partner.
That's so interesting.
I don't like using the word victim, but there is now a word known as narcissistic victim syndrome. It is not legally or not put into the diagnostic manual at present, but we do tend to use that word, narcissistic victim syndrome.
That's really interesting to me, that you have individuals coming to you, have patients coming to you who are brought by this person saying, listen, Sally, she needs help, she's just all wrong, when it's really that person who has created the setting that Sally or Jimmy is just. So this makes me think of the term that I'm hearing a lot of is, you know, this pop psych terms, gaslighting.
Yeah, gaslighting. Gaslighting is something that I never said that, I never promised that, I never did that. That is one of the very common trait of narcissistic personality disorder, and you're right. And they will come that she is depressed because of reasons, and I'm not at fault, and I never did anything to make her feel depressed. So that's gaslighting, of course.
So if you're someone you found yourself in this situation with a narcissist, what do you do? Dr. Grover, what do you do?
Are you asking me if I myself am in a situation?
No, if
I will run away.
But if someone...
I will choose the flight.
But But you
And I will never
recognize
come
it,
back.
right? But you're educated. You're educated. You get it. You see it. You identify it, right? But the folks who are watching your channel, who are watching your YouTube channel, I am sure you have audience out there who's watching this, trying to identify if you're talking about them, trying to identify, am I the person the narcissist is bringing to your office? So how does that person say, you know, my partner's a narcissist, my child, my mother is a narcissist? How do they identify it? And then what? And then what?
It's my job. I have to be honest to them. I have to tell them that, yes, you know what, it seems to me you do have some traits of narcissism, and I hope you understand that this was not all her being in depression. There are some environmental factors or situational factors, which is you being in her family system, which is causing this depression.
How interesting.
So some of them they accept it, some of them they don't. Most of them they don't. The patient with narcissistic personality disorder, it's a hard one. They will not accept it, that they have these issues.
Are there behavioral medications that can address this? What do we do once we've identified, say, a family member, and this individual absolutely is diagnosed as a narcissist? What do we do?
What I suggest to people, that convince them that, hey, you know what, this is not working. I really want to have a good relation with you, mom, or I really want to have a good relation I want you to be in your grandkids' in life.
Yeah.
So let's go to a therapist to make it work. And when the therapist causes some clarity about it, then it depends. We have to convince the patient. But medicine is out of question, because we cannot ask a patient, just a human being, to consume a chemical without their wish, right?
Yeah.
They have to support themselves, and awareness is the first step. And if they say, yeah, you know what, yes, I did that, and I think, yes, I am like that, I am being selfish, so I think I would like to change, then we have hope for treatment and therapy. Yeah. With borderline personality disorder, it comes to the point that they are self-harming themselves and they land up to ECMC or the urgent care. Then they are left with no option. They have to come for treatment. Yeah. And then we make them realize you have borderline personality. So emotional maturity is easier to be supported. The patient with borderline personality disorder is it's easy to support them with development of emotional maturity. And as it is with years together in therapy and going through that experience, years together, they learn it. Because what I tell them in therapy, the patient with borderline personality disorder, whenever you are becoming emotionally high, and you need to ask this question, what's happening to me? Am I getting angry? This is emotional intelligence, right? And then the next question is, do I need to really react now in this situation? Or I can withdraw myself a little bit so that I can respond in a good way. I can respond in a better way. And if the answer is no, withdraw. Out here, we don't count it as avoidance. We count it as a therapeutic technique of avoiding coming out of the situation, then having some clarity of mind, and then going back. Take some time, take some filler, take some buffer in between there. But if the answer is yes, I have to react in this situation, then compose yourself, remain grounded, and then react. And react with the starting statement, this is really making me feel angry, and I don't want to lose it here. So let's talk about it in a corner of the room in a good way. So that's what I teach them, the social communication skills, rather than reacting with their emotions.
That must be such a relief. Sure. For these individuals who are living under this extreme emotion all the time. It must be such such a breath of fresh air when someone is finally made aware, right?
Yeah.
That what you're feeling is manageable. And not so much your fault or you're a bad person, but that there's an actual tool that you're missing. You don't have this in your toolbox.
Toolbox, you're right. They don't have. But then the way it works is that they start when the patient or a person is with a narcissistic personality disorder patient, like a daughter or a partner. First, they are going through that so many times that they become they shut their compassion circuit and they emotionally detach themselves. First, they will try the path of being resilient, right? They will try to accommodate, they will try to adapt, okay? They'll try to come back out of that rough time, but then they detach themselves emotionally. If they are going to a therapist, when they come to me, my job is I use that emotional detachment in a positive way. I teach them self-actualization. Okay, I teach them how to grow positively out of this negative emotional detachment, right? And then dialectical behavior therapy. We have techniques to open up their compassion circuit, which they had shut down. We have techniques for that. We have exercises for that. That's what we teach them then.
This emotional shutdown, this emotional detachment, is this something you're seeing as a result of this person falling under the influence of the narcissist behavior?
Yeah, no, the person who is going, who is with the patient who is going through a partner or a mother of narcissistic personality disorder.
That's where they find this detachment.
Disconnect. And even the patient with narcissistic personality disorder, they are emotionally disconnected when they started with this personality disorder. That's one of the main reasons. They are vulnerable from inside, they're insecure from inside, but they don't want to show to the world. So they show to the world with that grandiosity and with that mask that I know everything, I am smart, because they are socially intelligent.
Yeah.
They're socially intelligent.
Are you finding the folks who are narcissists, you know, it's not just a term you're throwing out there, because it's kind of, I think it's kind of become kind of a popular thing when you don't like someone, oh, well, they're a narcissist, you know, I see it in social media all the time. Oh, he wasn't nice to me on a date, he's a narcissist. So we're not talking about this, this kind of pop culture use of that term, but an actual narcissist, clinically diagnosed narcissist. Are you finding that these adult narcissist people had trauma in their childhood? Are we finding like lines and parallels to solid reasons why they've become this? Or is this simply so deeply rooted in who they are in their brain function that it can't be avoided?
There is, of course, the family is dysfunctional when because when the personality development starts 12, 13, 14, 15, 16 years of age, right, 17, personality development is going on. So there's some dysfunctional family which is going through neglect, and even, who knows, the mother herself is a patient of a person with narcissistic personality disorder, and the pattern is being passed on. Yeah, so that's, I made a very interesting video on that too. My last video before the Baby Joe's video discussion with Baby Joe, it was about how to cope with a narcissistic mother or parent or a partner. So it's again, because this emotional intelligence, emotional maturity, emotional manipulation, then emotional detachment, these all are all the things which are playing into the forming the personality of an individual as a part of emotional development.
Right.
Right. So in the person, with whom emotional maturity is missing, or emotional detachment is more, or emotional bonding is missing, or even emotional manipulation is added into their behavior, of course that person's emotional development is not going on the right way. So the personality disorder is going to curb up or come up at some point.
Yeah, it's going to rear its ugly head.
Of course.
I think it's so interesting that you pointed out that this personality, the borderline personality disorder, it can appear, right? And you were saying usually around 16, but conversely, around 32, it can go away.
It can go away if once again you are aware of it and you've caused awareness, you are committed to it, and you are ready to end it with the therapist.
I think that just offers great hope. I had no idea before we sat down and talked about all of this, that the emotional intelligence and the emotional maturity could literally lead someone out of a disorder.
Yeah. And having hope to change your, having hope to have more emotional maturity or emotional intelligence is one of the also a definition of being emotionally mature.
Yeah, having that hope is part of the maturity. Isn't it interesting? The way it all, I mean, it's so interconnected.
Yeah, it is.
And the hope that even if maybe you came from, one of these backgrounds where you were in a household where there was no emotional maturity from your parents or your siblings, that your future is still your future. There's still that hope.
Yeah.
Of course, you've got to find a good doctor.
Yeah, because you were, once again, I will say, because you were in a situation or maybe with the people around you or the family that you became emotionally paralyzed or paralytic.
We talked about that when we started, right?
Yes.
That emotionally paralytic, and you called it that fog.
That fog, and the emotional intelligence and emotional maturity goes missing.
That's incredible, that fog. So it's almost an emotional shutdown.
Yeah.
But with a narcissist, that emotion was never there.
Oh, that was never there. The empathy is missing.
Very interesting. I often wonder, I always think when people do things, when we do things, we have a reason for everything we do, and usually, we're going to make decisions and make moves because we're going to gain something. I go to work because I get paid, I can buy food and pay for my car and my house. There's an outcome, right? And so I always wonder, for a narcissist, what are they really gaining when they're alienating? But somehow, right, a narcissist in their universe, what are they gaining?
What we call that as narcissistic feed. They are seeking satisfaction from that feed.
They are satisfied.
They are satisfied.
That's
the way.
Are they satisfied because they see this person is tortured? What is the satisfaction?
It's the control over the emotions. What is narcissism? Power, control. High on the pedestal.
I see.
So they're controlling the person's cognitions, they're controlling the person's emotions, and they think they're winning the battle.
That's very powerful.
And they win the battle. That's the way they perceive.
It's a battle that doesn't exist.
It is. No, they are having their own games and battles.
Yeah. It exists for them.
It exists for them.
It
exists for them. The whole world is battling for different things, but they, in that scenario situation, are playing their own game.
Very interesting.
Right? The whole event is about something else, but they are having their own event in their mind, a story, and they are playing that story in that event.
So the narcissist comes into whatever the situation, and the emotionally intelligent person sees the situation as it is.
As it is.
The narcissist literally has their own script. Their own dialogue.
Own script, own game, own drama.
And it's the same situation, it's the same people, it's the same room.
But the game and the script is different.
And I would assume someone who is emotionally intelligent and has learned emotional maturity is going to identify the narcissist.
Of course. That's what they do. And that's what they say. Then they have to choose between fight or flight. And most of them flight. They run away.
The narcissist runs
No,
away.
the borderline, the other person. The person who doesn't want to deal with narcissism.
I see.
The one who doesn't want to deal
So
with narcissism.
the person with the emotional maturity is going to identify and say, I'm done with you.
Yeah, and the way the therapy works with us is that what I tell my patients, that even if you have gone through a person with narcissism next to you for years together, days together, okay, and they say, oh, I'm broken and I'm breaking more, I tell them, you are not breaking, you're not broken, you are unfolding. You unfolded yourself, because if you look at yourself backward, you were at this point with emotional intelligence and maturity. With this scenario and situation, you got an opportunity to unfold yourself. You learned more about yourself and the other person. And now you have emotionally developed to the point that you're ready to bid goodbye to them. So you unfolded. It took time, but you unfolded. Once again, I really like that song of I am not broken, I am not breaking, I am unfolding by Lucas, Lucas Folgel. I like that song. I love that song. It's a very good song. So it's out here. What is therapy about? Therapy is about causing awareness, supporting the person to open their compassion circuit, supporting the person to emotionally develop, to emotionally be more intelligent, and to be mature, and to unfold themselves in a right direction. That's what the therapy is for.
Dr. Grover, incredible. Thank you so much. This was really eye-opening. I learned so much from you today, and I'm sure that anyone watching learned so much from you today. Thank you for sitting down with us and for unfolding.
I like that.
Thank
you very much, Kim, for being here. It was wonderful to have a conversation with you. And once again, we will see you in our channel again.